Today's discussion is going to be about pandemics, and we're going to start with this slide. The four horsemen of the apocalypse are war, famine, death, and pestilence, as described in the Bible. The last is described as a contagious and infectious disease, which is both virulent and devastating punishment for the wicked and unfaithful. For millennia, the mass movement of human populations, often related to war, altered existing populations and environment, leading to pandemics. The recorded history of man, from the beginning of hunter-gatherers, cultivating crops and domestication of animals and storage of water in cisterns, interrupted environments and produced recurrence of destructive pandemics. In the calamitous 14th century, bubonic plague killing 40% of the population of Europe, to 1918 and the deaths of 50 million, to the AIDS epidemic in the 1980s, 30 million dead, until today's events, a disease that's been going on for about 10 months or so. What I'm going to talk about for this hour is what's called the American plague of the 18th and 19th centuries. It was spread by slave ships picking up black cargo along the coast of Africa, along with a deadly viral disease, unwittingly, and spreading that to North and South America and the Caribbean over a period of 250 years, at a time when the cause of the disease was unknown and there really wasn't much in the way of treatment. The name of this disease was called yellow fever or yellow jack or scourge of the South. It was also called the stranger, newcomer, or immigrant disease because that's who got the disease. If you were in a yellow fever epidemic and survived, you were immune for life. But waves of immigrants were not immune, and that's who died from this disease. And as in history, very often the patient is blamed for his condition. Yellow fever is caused by a virus, the RNA Flavivirus, which is similar to Ebola. It is simply a ribbon of RNA wrapped in protein. It has no nervous system. It has no politics. It simply obeys Genesis, which says, go forth and multiply. And that's exactly what it does. This is a microscope in the Hartford Medical Society's museum. It's Leeuwenhoek's invention of the 1600s. He didn't know what he was looking at. They did not know that bacteria or viruses existed. In the 18th and 19th century, their medicine was very different than what we know today. Medical school graduations were often open to the public, and the guest speaker was usually a famous physician, a chief of medicine of some school. And they would usually address the audience by saying, medical science is at its peak. We know more about medicine than ever before, and aren't you lucky, the public? Well, what did they actually know? They knew that pus was good, that pus was laudable, that germs existed would await Louis Pasteur discovering anthrax and the yeast in fermentation of wine. Surgeons wore neither mask nor gloves. They didn't wash their hands or their instruments. There were no intravenous fluids, so you couldn't hydrate somebody. Blood types would not be discovered until World War I, and penicillin was first given in 1941. If you had an open fracture of the femur and went to Hartford Hospital, which opened up around 1860, the doctor there would say, your mortality rate is 50%. The same was true in Paris, London, and Edinburgh, Scotland. If you went to an emergency room today with an open fractured femur and the doctor said the mortality rate is 50%, you would probably ask for a second opinion. That there are 3,500 mosquitoes types of mosquitoes. Only a handful carry human disease and are a vector for disease. This fact was not known until the end of the 19th century. But is it essential to know the pathogenesis of disease to treat it? The answer is no. In the 16th century, Jesuit priests who were doing missionary work in South America noticed that the locals were treating febrile illnesses with the extract of the bark of the cinchona tree, which is actually quinine. They brought that great discovery to Europe and enabled them to treat malaria for 300 years before its pathogenesis was really understood. Yellow fever is a virus which is carried by this type of mosquito. It's small in terms of these kind of bugs. It has short wings, which means it can fly just a short distance. For example, it can't go to the second floor of a house. It can go perhaps 80 feet. So if it's living in the hull of a ship in latent water, it can fly ashore, and if it has the virus on board, whoever it bites gets the disease. In the 18th and 19th century, waterfront property was where poor people lived. Now it's the reverse. And so it was people in tenements in unsanitary conditions who were the first to suffer from this. This particular mosquito also carries dengue virus, Zika, and chikungunya as well. So that's the pathogenesis of yellow fever, which was not known for 250 years. The clinical picture is fever, malaise, and severe body pain, severe back pain, neck pain, retroorbital pain, headaches. It's described as if your bones are breaking or your joints are dislocating. A subset of that also had bleeding from the nose, mouth, and stomach, and jaundice, deep jaundice, and black vomit. The black was bleeding in the stomach, and seizures. So if you had these three conditions, your chances of surviving were nil. Some of the patients had priapism, which we know today would be from thrombosed veins, but in those days, they assumed it was from moral degeneration, and the patients got what they richly deserved and advised no sex during yellow fever epidemics. My son recently was visiting us for the Thanksgiving festivity and from New York, and he asked me, well, if they didn't know that virus causes, what was the cause? And I thought that was a good question. Well, the answer is this. Most people thought that the disease came from decomposition of organic and inorganic materials in wharfs in the streets around buildings. In other words, filthy cities caused this disease, that a miasma came up, a gaseous substance filled with poison, and that was what the cause of the epidemic was. And they labeled it as pestiferous effluvia, which is Latin for we have no idea. And the public got tired of hearing of that phrase, so they changed it to morbid miasma, which is Latin for we still have no idea. So if you believe that the disease came from within, from dirty cities, the answer is going to be sanitation, not quarantine. And most people believe this. The second cause was that it came from without, that infected ships, perhaps with this miasma in its in the bottom of the ship, somehow got ashore. It was known by the anti-contagionists that if you took a patient with yellow fever and moved them a half a mile away, the disease did not travel with that person. He wouldn't give it to someone else. They also knew that the wives and girlfriends of people with yellow fever never got the disease. They would sleep in the same bed, the same sheets, the same pajamas, absorbing the bodily fluids from the person that was sick, and it didn't get transferred. If you believe this, then quarantine makes a great deal of sense. The third cause was that divine judgment against sinful behavior was the cause. The abolitionists in the North said that yellow fever was God's punishment for slavery. The subject of quarantine has modern connotations. France, Spain, and Italy and the rest of the European nations were for quarantine. The word means 40, and it was used in 14th century Venice to stop ships that might be carrying plague coming in. Great Britain and the United States were opposed to quarantine for business reasons. And they hired naval officers, army officers, and scientists to write pamphlets and books outlining why not only is quarantine ineffective, but actually harmful. Gautier was one of them, and he wrote that quarantine was useless and injurious, an absolute and uncompensated evil. Another person wrote, quarantine equals despotism and the opposition to individualism. You hear the same stuff today that it interferes with civil rights, the individual civil rights to speech and religion and whatever. So history repeats itself, doesn't it? There were marine hospitals up and down the East Coast, and they served as a place for sailors of ships to come when they were ill. And this is a picture of a hospital in Staten Island, New York. The city had put a quarantine for yellow fever. And what happened was the merchant marines and their families rioted and tried to burn the hospital down because they no longer got a paycheck and couldn't support themselves. So business and financial interests play a big part on how healthcare is delivered. The first attack of yellow fever in America, in the United States, was in Boston in 1690. There were attacks in New Haven, in Middletown, Connecticut, New York, Philadelphia. Philadelphia had numerous yellow fever attacks, beginning with the Constitutional Convention in the 1780s, almost driving George Washington and the conventioneers out. In 1793, there was a particularly severe event killing thousands. And Dr. Benjamin Rush, who was probably America's most prominent physician, who had signed the Declaration of Independence, wrote a pamphlet on what happened. And he said that the disease was caused by rotting fish, and that the best thing, which was quite successful in his hands, the best treatment was the heroic treatment, which was bleed to syncope, mercury to salivation, which means large doses of mercury, and large doses of quinine. Dr. Rush could not have been more wrong, but his teachings persisted until the Civil War period. In France and other countries, they stopped doing this much earlier on and thought, let nature take its course. The last yellow fever epidemic in the North was in 1820 because the northern cities installed sewers and pipes for that purpose. But more importantly, the water pump was invented, which meant that you didn't need cisterns filled with stagnant water, which is how mosquitoes generate. And so after that, it was the South that suffered under recurrent yellow fever epidemics. Mercury had its advocates. Dr. George Dixon of Charleston claimed that you had to have skill to use it, and if you didn't have that skill, it didn't work. Dr. Wheaton of Rhode Island agreed that yellow fever was the Samson of the pharmacopoeia in that it's slain thousands. William Hammond, who was the Surgeon General of the Union Army during the Civil War, outlawed mercury because he saw the side effects. One of the terrible side effects was osteonecrosis of the sinuses, the facial sinuses, and there are other problems with that drug. The Army surgeons revolted because medicine in those days was a three-legged stool. One of those legs was mercury. It was used not just for yellow fever, it was used for virtually everything else. And they didn't really follow his order. Quinine had the same problem. There were people who thought it was the best thing since sliced bread, that it was magical. But those who dealt with yellow fever mostly, which would be the Southern doctors, saw that whether you used large or small doses didn't matter, and that it caused blindness, deafness, insanity, and death. Quinine can cause an arrhythmia, which can be fatal. Some people said, yeah, the operation was a success, but the patient died, and perhaps we shouldn't be using quinine either. When things go bad, you throw in the kitchen sink. Every doctor knows that. Antimony is one of the vilest poisons ever made, and it was used when patients did poorly from typhus or typhoid fever or whatever. Venesection, castor oil, spirits of turpentine. Turpentine was taken orally and in soap flannel patterns for a variety of conditions. Chloroform, pepper, and blistering agents. Mustard plaster, linseed, or Spanish fly were added to the brew of treatment. Hosea Knott was the professor of medicine in Mobile, Alabama, and he saw and knew from personal experience that the heroic treatments were not a good idea. As was said, as the apothecary shelves emptied, the cemeteries filled. And he said, good nursing and supportive care, that will do it, and the rest is harmful. Above all else, do no harm. Morton Dowler was a medical journalist, and he pointed out that, quote, contradictory volumes were filled with special pleadings, diluted logic, and theoretical biases and irrelevant facts. And he said one of the problems is doctors don't know how to say, I don't know. His recommendation for the yellow fever epidemics was stop immigration. This is a German and Irish disease. It was the German and Irish immigrants who were getting sick. And he said, why give us heavy taxation? If they die, they die. He also said that filth can't be the only cause because there are a lot of dirty cities in America and elsewhere, and they don't get yellow fever. So again, people are blamed for their disease, and that's how it is. New Orleans was the capital of yellow fever because New Orleans was booming, and immigrants flocked there. There were jobs because of cotton, rice, sugar, grain. They need workers, and workers came. So between 1848 and 1858, there were 6 separate severe yellow fever epidemics. In 1852, the city of New Orleans created a public health department to deal with this nightmare. This is a cartoon that was published by the New Orleans Picayune, which is still in print. And it shows one of the doctors that was on the board sticking a knife into commerce. If a town announced there was a yellow fever epidemic, it effectively closed the town down. Nobody is going to advertise in the newspaper, and nobody's going to buy the newspaper. Those who could leave left, leaving a deserted place. And you find that in Connecticut, for example, when there are typhoid fever or smallpox or diphtheria, the newspapers reported that when it was over, not while it was going on. So business interests count. There were not many hospitals in the United States at that time, because people were treated at home. The people who went to the state or city hospitals were the poor. They were pest houses. You went there to die. For example, in New York City, streetwalkers who were arrested were offered an option. You can either pay a fine or you could be a nurse at Bellevue Hospital. This is a picture of the hospital in New Orleans that was run by Tulane University. Their nurses were actually Sisters of Charity who did yeoman work dealing with these epidemics. The city was eternally grateful, and to this day, if you're a nun, you get free public transportation. But the public, particularly the newcomers, the immigrants, they didn't want to go to the hospitals because they thought the doctors were going to experiment on them. They knew it was the place you went to die, and they died alone. And that's no small thing. We have the same problem today. The Pope wrote an essay, and I'm going to discuss it at the end of this talk, about that, about people dying alone. So the patients were shamed, they were blamed, and then they were scapegoated. Then and now. The literature for yellow fever is voluminous, to put it mildly, but the best single reference was written by Renee LaRoche, who was a medical professor at the University of Pennsylvania, and he published in 1855 a 2-volume, 1,500-page symposium on this with hundreds of footnotes. I bought this set and spent a summer reading it. It's the best thing ever written about yellow fever. He has everything there is. It's very repetitive. And I came to the conclusion that the only person who ever read this is me, because LaRoche couldn't have read his book. Otherwise, it would have been just 1 volume if he edited it. At any rate, he describes experiments where they took the black vomit of patients with yellow fever and gave it to dogs to drink, and nothing happened. So the doctors drank the black vomit and to see what would happen, and of course, nothing happened. So they took fluids from people who had died from yellow fever, blood and other fluids, and they injected it into dogs, and nothing happened. So what did they do? They injected themselves, and nothing happened. And then there were doctors who did autopsies and would have lacerations, accidentally cutting themselves. In one case, they broke the ribs of a patient and the fracture lacerated their hand. So there was a mixture of the patient's blood who had yellow fever and the doctors, and nothing happened. So they concluded that that patients with yellow fever did not transmit it to others. LaRoche was an anti-contagionist, but he was also against quarantine. Interesting to me. He listed all the problems with the drugs, but at the end of the chapter on treatment, the treatment he recommended was quinine and mercury, despite what was known. The U.S. Sanitary Commission was formed during the Civil War, a private group to help union doctors and nurses with medical supplies and clothing and bandages. And they issued 16 pamphlets to educate the doctors, and one on yellow fever agreed totally with Dr. Knott that there's no cure for yellow fever. It should be managed, not driven. Don't bleed, don't use large doses of mercury or quinine. And yet, when you get to the paragraph on treatment, quinine and mercury. Some years ago, I was in Charleston, South Carolina, and found the Waring Medical Historical Library and Museum, which is right near their other medical facilities. It's a terrific little place. And I told them I was researching yellow fever, and they gave me what material they had. Well, the South Carolina Gazette, which was published in Charleston, had a sheet on the yellow fever epidemic that was taking place at that time. It was on the front page, and there was a little paragraph, which is a magnificent piece of deductive reasoning, which in my view explains yellow fever totally. And I just want to read it to you. Disease malignant fills the air, its noxious atoms far and near, spread through the ambient atmosphere with doubtful flight and casual wing, scoff bring their pestilential sting, or through the pores or lungs they pass, and taint your elemental mass. Not bad for a deduction. In 1856, the editor of the Charleston Medical Journal asked his readers to send in data, whatever information they had about treating yellow fever patients, because the results were so poor. Well, Dr. Williams of South Carolina sent in 3 case reports. They were a 17-month-old infant, a 5-year-old, and a 10-year-old who died from who had yellow fever, were treated the standard way with quinine. Only the infant survived. And underneath these case reports, he wrote, "I've been in practice for 21 years, and I'm ashamed to say I couldn't save my own children." So these 3 cases were his own children, which means when yellow fever was announced, he didn't cut and run, he stayed. And a lot of doctors did that, even though it was at great risk. These are from 3 different people who were living in a yellow fever epidemic in Charleston during the Civil War. Sister Jean Marie Reynolds, "Yellow fever is raging. It seems the wrath of God is down upon us." Another person writes, "Turning in almost any direction, the eye is met with tears of pestilence, desolation, and death. It is an unsparing pestilence." And lastly, our officers were dying every day with it, regardless of how incessant our intention were to them and how much of everything they needed were ministered to them by our hands. It reflected the depression that these conditions and the fatigue and the weariness and the terrible features of mass death from a pandemic that some of us are going through now. When the Civil War started, ministers of southern states got up in the pulpit on Sunday and beseeched their God to bring a yellow fever epidemic down on them, because, as one said, what Confederate bullets don't kill, the yellow jack would. Well, they didn't get their wish. I guess God was not on their side that day or those years. And the reason was the Union Navy basically blockaded the South, which meant it was quarantined. And so there were outbreaks of yellow fever during the Civil War in Galveston, Texas, in Florida, the Key West and the Dry Tortugas, Charleston, South Carolina, and in North Carolina, both Wilmington and Newbern, but none of this affected the war. In 1862, Admiral Farragut captured New Orleans, and a political general named Benjamin the Beast, or Benjamin the Spoons Butler, was put in charge. He was from New Hampshire. His father had died of yellow fever when he was just 1 year old, just outside New Orleans. And so he had special feelings for this condition. He had sticky fingers, though, and he cleaned up New Orleans. But more importantly, what he did was he hired doctors and paid them well so they wouldn't take bribes, and effectively quarantined New Orleans, who for the first time in years, in decades, had no yellow fever epidemic. The reason he was called Spoons Butler, when he eventually was forced to leave the area, it was said that there was not one silver or gold spoon left in Louisiana. Some years ago, I went and visited Newbern, North Carolina, which is on the seacoast, because 2 Connecticut regiments were stationed there during a particularly vicious yellow fever epidemic. This is a lithograph of that about the 1860s. It's formed at the junction of 2 rivers. One is just a tributary and the other is wide and shallow. And when the tide is out, you can actually walk across it, and that's how they farm oysters there. I visited a number of years ago. It was the end of August, first week of September. You can see the bridge in the lower left-hand corner. And I walked along the river. The 15th was stationed just outside of town along the river. And on the left-hand side were antebellum homes where the Southerners with their ice drinks and their starched shirts would wave hello. The next morning, my legs were covered with welts from all the bugs that live in that area. And I wondered what it must have been like having 103 temperature and yellow fever and 103 degrees temperature ambient. Well, when I was there, that's how hot it got a couple of days, 103. Must have been a nightmare. The 15th Connecticut came out of New Haven. They were the provost marshal of the area, which is the police department. Their doctor was Hubert Vincent Holcomb, graduate of Yale Medical School. His ancestors came over in the Great Migration, so he was a blue blood American. They called him the long, tall doctor because he was 6'4". Prior to the war, he traveled through Mexico, so he probably had some knowledge of yellow fever. He was called the long, tall doctor. The 16th Connecticut came out of Hartford, and their regimental surgeon was Nathan Mayer, who was an immigrant who came from Alsace-Lorraine and spoke German, was called the Little Doctor because he was 5'2" tall. The family came to Cincinnati in 1853. He went to Cincinnati Medical School, and then his father sent him back to Europe for further studies. The best medical education was in Europe. He went to the German-speaking states where he learned about the latest in hospital construction with Johann Wilhelm von Augustin Esmark, one of the great German surgeons of the era. He returned to the United States in 1862. His family had moved to Hartford, where his father was the first rabbi of that city, taking over Beth Israel. So you have an immigrant who is a regimental surgeon, which is an honorific spot that a lot of people didn't get. So you have a blue blood and a immigrant both having the same job and eventually working together. I thought this was a story that's typical of America, where you don't see anywhere else. The hospital he was assigned was Foster Hospital in Newbern. It's a mansion that was converted to a hospital. This is a photograph taken during that time period. I went to visit it, and it's now a parking lot. And I inquired, where did the hospital go? And they said it was moved, but we don't know where to, or even if it still exists. It was right near Craven Street, which is where the ship's dock, which is where the first cases of yellow fever first arose. Well, that summer, it's now the August of 1864, sick hall, the numbers on sick hall are up 5 or 6 times with fever, malaise, body pain, and they're being treated with quinine and a horn of whiskey. Quinine is a very bitter substance, so they would give them whiskey with it. And things aren't going well. Both Holcomb and Mayer start to think maybe this is yellow fever. Well, the director of the district is a Dr. Hand, and he said, do not put the diagnosis of yellow fever out, because if you do, this whole area is going to be closed down. The facts were that a presidential election was happening in November, and the state of Connecticut had amended the Constitution, the state constitution, giving soldiers the absentee ballot, and Connecticut agents were already on their way to collect the votes. If this was assigned yellow fever status, the votes don't get collected. So there were a lot of things going on here. The first week of September, a Sergeant Rogers of the 15th gets transferred to this hospital. He has jaundice, he has black vomit, and he seizes, and in 48 hours is dead. The patient in the bed next to him is a man named Nettleton, who knew him. They were both from New Haven. And Nettleton was on sick call every day for 3 years because he had an undiagnosed case of rheumatic heart disease. It was discovered after his service in the Army. And he had a dim view of medicine. He said, if you put a sick patient and a well patient together, most doctors can't tell one from the other. And he wrote home about neighbors and friends and associates who were sick from the disease, as he was, and dying. 1,200 people died. 800 or 900 of them were civilians, and the rest were soldiers. And Nettleton described the severe weakness he had for weeks after. An autopsy had been done on Sergeant Rogers, which is why they made the firm diagnosis. He had what I assume was acute yellow atrophy, and this is what it looks like. It's almost pathognomonic for yellow fever. 3 officers of the 15th died. One was the quartermaster, who was a close personal friend of Dr. Holcomb. There were about 50 privates who died. Luke Boylan was one of them. And they are buried in a federal cemetery in Kinston, North Carolina, which is inland a bit, about 20-minute drive northwest. It's a very nicely done cemetery. It's divided by regiment. This is the statue for the 15th Regiment. I counted the stones. 35 deaths from yellow fever are buried here. And on the other side of this monument, it says most of these fellows died from yellow fever, but of course, dead is dead. William Thompson also wrote a lot of letters home, and he was offered to stay at the regimental hospital with Dr. Holcomb or go downtown. And Holcomb pointed out that the disease seems to be originating from where the hospital was in Newbern, which was right where the ships docked. So he stayed with Holcomb and was treated with quinine and a horn of whiskey 3 times a day. But it didn't satisfy his taste, so he went and bought Ayer's Aid Cure, which is basically booze, and survived. As the epidemic of yellow fever continued and the town emptied out, the administrators of the city needed to find out who was still alive. And they sent Captain Buttricks to go door to door to find out. And he was horrified by what he found. There were entire families that were dead, and in the heat had emulsified. And so the stench and the horror of it had a severe impact on those who saw it. This is a lithograph of the yellow fever epidemic in New Orleans, but aside from the height of the buildings, you would expect the same anywhere. In New Orleans, they put barrels of pitch and tar and lit them on fire to make black and gray acrid smoke to chase away the miasma. In Newbern, they used turpentine because they had turpentine with the yellow pine trees, which make turpentine. So you have this black acrid smoke. They took calcified lime, which is basically Clorox, and threw it here and there and everywhere. They fired cannons at 6 a.m. and 6 p.m., and they watched as stacks of dead and unburied and buried people at the cemetery collect. This is a photograph of the burial team. The normal people who buried had left town, and they were left with runaway slaves and other black folks. It was reasoned that blacks are more or not as sensitive to yellow fever and has a general resistance. And this was assumed for a long time. I'm not sure that's true because they didn't immigrate. They weren't recent immigrants. Were probably living in that general area and most likely were exposed previously to yellow fever. And I suspect that's why they were relatively immune. But dealing with the dead from these pandemics is a nightmare. This is a picture from last week in the Wall Street Journal. There are 660 bodies in refrigerated 18-wheelers parked in Brooklyn and don't know where they're going to put these. Some of them, they don't know who they are. And the ones that they do, the families don't want to claim them because they can't afford the burial fees. After the Civil War, there were recurrent yellow fever epidemics in New Orleans, particularly 1867, 1878, thousands died. The mortality rate ranged from 7 to 28%. The last yellow fever epidemic was in 1904. The New Orleans Picayune castigated the latest immigrant group, who were the Italians, and they claimed the reason they got the disease is that they were recent immigrants and had their faults, and also that they ate too much macaroni and bananas. I can't explain it scientifically. When Cuba had reached the 50th year of its anniversary, they invited various groups in to see their medical facilities up close. And my friend and medical school classmate, Jack Kenny, who was over here, invited me and my adolescent son, Ben, that's me, to Camagüey, where they were, he's from Madison, Wisconsin, and they were the sister city and had been doing missionary work medically with them, bringing equipment and medications and things. And so we went to Camagüey with him. I brought some stuff, gifts for the medical people, instruments and suture material. Anyway, the medical school was named after Carlos Finley, who was a blonde, blue-eyed Scotsman who happened to have been born in Camagüey and was the first person to say, this little mosquito is the vector that's transmitting the disease. And Walter Reed, who deliberately infected his own men with these insects and proved that fact, gave full credit to Dr. Finley to Dr. Finley for his work. For those of you under 30, if there are any in this group, there was a movie called The Ten Commandments where Charlton Heston plays Moses. It's the story of Exodus. And he's dealing with a stiff-necked Pharaoh played by Yul Brynner. He inflicts 10 pandemics on the Egyptian people, boils and locusts and mosquitoes and fleas and leprosy and darkness and bloody water, and ultimately the death of the firstborn son. The commandments of the 19th century were quarantine, supportive care, good nursing, public sanitation, and for some people, mercury and quinine. The commandments now are listed. I know this audience is fully familiar with that. It occurred to me that what America needs now is a second American Moses. The first was Abraham Lincoln, who was so called that by Harriet Beecher Stowe, who wrote Uncle Tom's Cabin. And when Lincoln left Springfield, he would free the slaves and he would bring us through the wilderness into the promised land. And my choice for that is a man with great experience with stiff-necked pharaohs, and that would be Dr. Fauci. He gave grand rounds with through the auspices of Massachusetts General Hospital about 2 months ago. He was just terrific. And he made some good points, as he always does. He said, we should have humility to know what we don't know and realize that we're going to learn a lot as time goes on. But the facts, the science must lead. And keep hopeful because the cavalry is on its way. There are great similarities between yellow fever and what's happening now. The social determinants, who gets the disease and how do we deal with that? The effects of economy and business interests, political differences, what works and what doesn't. For yellow fever, it was supportive therapy only, good nursing care. We now have lots of things that we can do for COVID-19. Quarantine was effective in yellow fever. It worked. Individual quarantine now for COVID-19 works. A few weeks ago, a Supreme Court justice addressed the Federalist Society talking about freedom of religion and freedom of speech, saying there are unimaginable restrictions on individual liberty, severe, extensive, and prolonged. Pope Francis has written an essay that was published in the New York Times this Sunday, which came on the other side of this issue, talking about it's important to know what is the common good. Do we have a regard for all citizens? And that being an ideologue and standing in the way of science is not the proper approach. He said the antibodies of the virus are doctors and nurses. Several months ago, one of my patients asked me what I thought was going to happen with this epidemic, and I said, well, most likely we're going to have a couple of vaccines and we're going to get through this. And she said to me, It's hard to know who to believe. Well, when she told me this and I knew I was going to do this webinar, I went in my little office and I wrote it down so I wouldn't forget. This is what a lot of people are stuck with. Who do you believe? Dr. Gottlieb, Scott Gottlieb, the former head of the FDA, in an op-ed in the Wall Street Journal wrote, "Wishful thinking is not sound policy." The Hartford Current, October 4th, they evaluated how are doctors doing treating people in the ICUs. These were infectious disease experts, and one said, there was a helplessness that you'd be watching these patients decompensate in front of you and there was nothing you could do. The doctor in Charleston, South Carolina, who treated his own children, said exactly this, and the nun in Charleston also said exactly the same thing. Another person, another infectious disease expert said, we have never really encountered a time in medicine like this where on a worldwide scale, unproven treatments were being given without any evidence. That is false. For 250 years, the American epidemic, that happened. This is, again, October the 4th. There are no effective treatments to reduce mortality. Well, we have reduced mortality 70% because of better delivery of oxygen, serum antibody, IV dexamethasone, and other measures. So we're learning about this, and we'll be learning about this for years to come. The cavalry indeed is on its way. This is a statue at the National Archives in Washington, where I've spent a lot of time doing research. And at the base, it says, what is past is prologue. This is from Shakespeare's The Tempest, and it's often quoted. Kierkegaard's remarks might be more pertinent. It says, he said, life can be only understood backwards, but it must be lived forward, where men of science, men and women of science, will bring us through the wilderness into the promised land. And so these have been the adventures of the Spar ship Enterprise. Its 50-minute mission to explore strange new worlds, to seek out new life forms and new civilizations, to boldly go where many of you have never been before. I hope you've enjoyed the trip. I'm told that we're going to take questions and I will try to answer them.
Dr. Spar, thank you very much for that. And I would like to ask now if there's anyone who has questions, please type it into the chat section, or you can raise your hand and we will turn on your mics. One is, will this be a podcast? Can I pass it on? We will be posting the video online on the hartfordmedicalsociety.org website, and you would be able to share it. So sure, not quite a podcast, but almost. And we would welcome any additional questions. Otherwise, I'd like to say Dr. Spar, I'm a big fan of Noah Webster here in West Hartford, and he actually tried to collect information from doctors about yellow fever. He was in Philadelphia at the time and was concerned that the medical community wasn't communicating with each other on their knowledge base. Sadly, he didn't get the right answer about the whole mosquito thing, but he did his best to try to create a collaboration between doctors on the yellow fever. That's my only addition to this. I'm getting very positive. Oh, when was the yellow fever vaccine developed?
Well, when I was sent overseas, I got the yellow fever vaccine, and me and a lot of other people, and I had a sore arm and I was sick for a week along with everybody else. So it's not so benign. The first vaccine ever made, well, actually, yeah, the first vaccine would have been smallpox. But in terms of modern times, the first vaccine in the 20th century, which is when this came out, was yellow fever, the first one. Yep.
I don't know if you can see the chat, but you're getting very rave reviews from people who listen to the conversation. And we'll give it another, we have another 5 minutes if anyone else has any questions. I am so happy to have Dr. Spar here today because I've always wanted to have one of his talks on video. So this has made my day. So I hope it's made yours too.
So there is one more in the chat.
Oh, was this the disease during the building of the Panama Canal?
It sure was. Yeah, Dr. Yeah, it's a big deal. I mean, without what Walter Reed did and a fellow named Gorgas, Gorgas, the Panama Canal doesn't get built. The French had tried it and failed because they were wiped out with malaria and yellow fever. When Napoleon invaded Haiti, there was a kind of a conflict there. The truth is that 75% of the French army died from yellow fever. So these diseases play a huge part in history. Speaking of Napoleon, his armies were surrounded by pyres of smoke, and he kept cisterns of water covered. When his army went into Spain and Italy, he surrounded them with smoke, and the reason was malaria. And while he didn't know a thing about mosquitoes, he read Leviticus, and in Moses' laws of sanitation, when soldiers came back to avoid epidemics, they surrounded them with pyres of smoke. And in Leviticus it says the cisterns of water must be kept covered. It doesn't say because mosquitoes breed. So Napoleon, who was actually born in Corsica, this is a little known fact, he was baptized and he was bar mitzvahed at the same time in Corsica. That's how he knew all this, of course.
I had a question of how does quarantine work with a mosquito-borne virus?
Well, I think I forgot. Well, I'm not sure I mentioned this, but if you have a quarantine, the disease comes in by ships, infected ships. So if you take a ship and say, we're going to quarantine you for 30 days, that's what Benjamin Butler did. It was a 30-day automatic quarantine on every ship. And so some of the ships did have yellow fever. And if it came that they did have it, a yellow flag would go up so everybody could see. And the ones who died were thrown overboard. Sometimes they would put them in coffins. And doctors actually went after the ship to treat the patients there, knowing they were in a ship with yellow fever, and they treated them with quinine and mercury. So the thing was, if one ship gets through that has yellow fever, you're cooked. You have to have an absolute quarantine. And that's what Butler put on New Orleans. Now, if you have a ship full of bananas anytime in New Orleans, say from the end of May till the beginning of October, in 30 days, you got banana soup, you know? So I mean, it's hot there. So it's from a business point of view, the quarantine is a tough thing, but it'll stop yellow fever. It works.
I have another question, or somebody asking, what are your thoughts and why Americans seem to be so fearful of vaccines? How does this fear compare with other modern countries, if you know?
Well, when smallpox, the mortality rates from smallpox is 25%. In addition, it leaves scarring. So for women, you know, you might have a scarred up face. And many people refuse to be vaccinated, claiming that if God wanted me to be immune to smallpox, he would have vaccinated me, and just refused. So that there's nothing in the Bible about don't get vaccinated, you know. The Hasidic Jews in Brooklyn, they don't get vaccinated for measles, and so they have probably the world's highest rate of that disease. There are religious groups who have, in their interpretation of their Bible, that somehow this interferes with God or whatever. And that's, you know, I guess you're entitled to that sort of view, but their position seems fixed in stone. There's not much, but throughout history, people were just reluctant to. Thomas Jefferson and George Washington were vaccinated for smallpox. Once they heard about it, they were hot on science. They both got vaccinated, and all their slaves got vaccinated, whether you wanted to or I don't know if any of the slaves said, you know, I don't want to be vaccinated. It's a God wouldn't, but they all got vaccinated. The Union Army was pretty much vaccinated. They had sometimes the specimen was poor and it didn't work, but very few of the Southerners were vaccinated. So, but so this, why are people fearful? Read, you know what? Read the Pope's essay. It's in the Sunday edition of the New York Times. It's very interesting.
I also have another question. The yellow fever vaccine consisted of what substance? Was it an inactive virus?
I don't know.
All right, fair enough.
You have to ask Dr. Fauci. He would. I'll tell you, he wrote an article with Dr. Moran. It's in the journal called Cell. Came out in September. It's online, and it gives a detailed exposition on pandemics and viruses, and it's very technical. It's not easy to read, but it might answer that person's question.
And I think we've now hit 1 o'clock. So Dr. Spar, if you want to stay on a moment when we end the program, we can catch you up on some comments that are made here. And I would like to thank everyone for joining us this evening, or this evening, this afternoon. Thank you for spending your lunch with us. Come visit us at the hartfordmedicalsociety.org. And on our website, you will see upcoming events as we're beginning to post the new events for 2021. So thank you again and have a great afternoon.